The Code of Conduct is an overarching practice standard describing the behavior and conduct all nurses in Ontario are professionally accountable to. There are 6 principles in the code. This section of the webcast will focus on Principle 2. Principle 2. Nurses work together to promote patient well-being. In this principle, nurses demonstrate how they collaborate and communicate with patients. Principle 2 also features the following expectations of nurses. Nurses understand there may be gaps impacting patient care and health outcomes in some communities. They work together with healthcare teams to address these gaps. Nursing care is timely. When this is not possible, nurses explain the reason for this delay to patients. In this section, we will review 2 scenarios showing how nurses meet these expectations. Scenario 1. Timely care. Joe is a nurse in a busy health clinic within an Indigenous community. His patient, Marla, is elderly with advanced dementia. She has had a fever for the past 2 days and visits the clinic with her son, Louis. Louis wants his mother seen as soon as possible. Joe is very busy with other patients requiring urgent care and cannot see Marla right away. Joe wonders what his accountabilities are for providing care to Marla and Louis. How should Joe proceed? Joe reviews the Code of Conduct and determines he is expected to provide timely nursing care, and when this is impossible, he must explain the reasons for the delay to patients. He talks to Marla and Louis and explains he cannot see Marla right away because of his current workload, but he will consult with the healthcare team to see if another nurse is available to assess her. He also explains that if another nurse is not available, he will come and assess Marla as soon as he can. With the healthcare team's assistance, Joe adjusts his workload and sees Marla. Joe would like to obtain blood work on Marla. He understands that while he has authority within his scope of practice to order and obtain blood work, he also has an ethical and legal obligation to obtain consent for any treatment. He recognizes with Marla's advanced dementia, she cannot give consent to treatment. Joe must obtain consent from Louis. Joe consults the consent guideline to ensure his practice aligns with the steps for obtaining consent from a substitute decision maker. Louis provides consent to treatment, and Joe draws Marla's blood work. After Joe completes the rest of Marla's assessment, he feels confident in the care he provided. Joe reflects on how busy the clinic is and his community's needs. He recognizes there are many patients requiring care, but not enough staff to provide timely care. He calls a healthcare team meeting to discuss and identify different ways to address these gaps. Together, they advocate for changes in staffing and workload policies within their organization. Scenario 2. Meeting language and communication needs. Nishma works for a home care nursing agency in the community. She visits her patient Maria, who requires a dressing change for a wound on her tailbone. Maria's first language is Tagalog, and she speaks minimal English. Nishma does not speak Tagalog and wonders what her accountabilities are when there are communication barriers. Maria is also anxious and unsure of what to expect from her first home visit with Nishma. Because she speaks little English, she is concerned about being misunderstood. What should Maria do? Before the visit, Maria receives an information package from the home care agency. The package includes a copy of the Code of Conduct translated in Tagalog. After reviewing the code, Maria learns that, as a patient, she is involved in any decision-making about her own care. She understands her nurse will work with her to resolve any concerns. Knowing her nurse has an accountability to meet her language and communication needs eases Maria's anxieties. How should Nishma proceed? Before her visit to Maria's home, Nishma spends time researching different communication tools. She understands she has an accountability to meet her patient's language and communication needs. This is important for the patient's well-being. She finds her organization's communication board, which outlines key words and phrases in Tagalog. She also downloads a mobile translation application to help during her visit. At the visit, Nishma introduces herself and explains her role to Maria using the communication board and mobile application. Nishma asks Maria if she has questions and what she can do to make Maria feel more comfortable. After hearing this, Maria feels less anxious and more at ease about the dressing change. She shares with Nishma her concerns about her pain and fears the dressing change may make it worse. Nishma addresses her concerns by conducting a pain assessment before the procedure. With a physician's order for pain medication, Nishma administers medication to Maria before the dressing change. After the dressing change, Maria feels pleased with receiving nursing care tailored to her unique needs. Nishma also feels confident in the care she provided and building rapport with Maria. To ensure Ontario's culturally diverse population can read and use the Code of Conduct, it has been translated into French, Mandarin, Cantonese, Punjabi, Spanish, and Tagalog. For more on Principle 2 and to access additional practice resources, translated versions of the code, and answers to frequently asked questions, visit www.cno.org/Code of Conduct. This concludes this section.